Patient assessment in the field. Patient assessment is a problem-oriented evaluation to identify potentially life-threatening injury or disease, followed by a clinical decision-making to determine the course of action. Components: dispatch information, the information you receive from dispatch, scene size up, mechanism of injury or nature of illness, safety considerations, general impression, initial assessment, focused history, physical exam, detailed, focused, and ongoing exams. General impression: is the patient sick or not sick? Is there an obvious emergent issue? Is there a potentially life-threatening condition? Does the patient need immediate interventions? What is your overall summation of the patient's condition? Initial assessment, primary survey, and ABCDEs. Cervical spine, if indicated, manually immobilize in the neutral position. Airway, obvious difficulty or abnormal sounds, clear and position as needed. Breathing, estimate rate, pattern, effort, and symmetry. Lung sounds, present or absent. Ventilate, oxygenate, decompression, or occlusion. Circulation, central and peripheral pulses. Amplitude regularity, and establish the rate, and ID the cause of that rate. Skin color, moisture, and temperature. Severe hemorrhaging, if so, control. Disability defibrillation. Mental status, loss of consciousness. Posturing, obvious sensory or motor deficits. Cardiac arrest, the hunt for VFib. Exposure, remove clothing as needed. Prevent from overexposure to environment. Evaluate, treat life-threatening problems immediately. Identify if patient is load and go or slightly delayed. Direct baseline vital signs, on scene or en route. Branching points, rapid trauma assessment, or detailed physical examination, or a focused physical examination. The rapid trauma assessment. The objective is to identify whether the patient needs to be transported now and why. It includes a rapid head-to-toe. What specific structures or findings are you interested in assessing in the rapid trauma assessment? Patient priority. What are examples of patient with a high priority requiring immediate transport? Why would they be a high priority? Detailed versus focused physical exam. What determines the need for the detailed versus the focused physical exam? What is included in the focused physical exam? Which systems and structures? What is included in the detailed physical exam? Preparation and reassesses. Preparation for immediate transport. Backboard, C-collar, SID, 10-point straps. Mast and splints applied if appropriate. Cover and protect the patient from the environment. Secure all if patient is being transported by helicopter. Reassess all interventions and vital signs, and early notification to the receiving facility. Posterior auscultation. Anterior auscultation. Trachea sounds should sound loud and harsh and be equal with inspiration and expiration. Bronchial sounds should be loud, high-pitched, and hollow, and seem a little bit prolonged on expiration. Bronchiovesicular should be soft, breezy, and lower pitched. They should be equal on inspiratory and expiratory sounds. Vesicular should be soft. Adventitious lung sounds: crackles, wheezing, and rhonchi. Heart sounds: S1 is referred to as the lub, S2 is referred to as the dub. A split heart sound would be S1 la lub and S2 would be da dub. S3 would be lub dub d and S4 would be d lub dub. Sites for chest auscultation. Heart sounds can sound like the following: a click, a snap, a murmur, a friction rub, and it could also sound muffled. History of the present illness. Sample history. Symptoms. What are the patient's current symptoms? Allergies. Be specific. Focus on medication allergies. Medications. The patient's currently prescribed medications and over-the-counter meds. Past medical history. Any significant and pertinent medical history. Last oral intake for potential surgical candidates. And events preceding the incident. History of the present illness, current health status. Current medications and over-the-counter meds. Risk factors for disease, the patient's family history, alcohol and or substance abuse, immunization, and occupation or environmental factors. History of the present illness, OPQRST. Onset. What was occurring at the onset? What are the contributing factors? Provocation, palliation. What makes it worse or better? Quality. Describe specifically. Prompt with an example choice. Region, radiation. Exactly where is the pain? Does it radiate? If so, where? Severity. How bad? Rate on a scale of 0 to 10. Time. Time of onset. Duration of pain and symptoms. Associated symptoms and pertinent negatives. History of the present illness. Gathering history is like charting a map. Identify the pertinent negatives to rule out possibilities. Continue looking for evidence supporting a specific diagnosis or limited differential diagnosis. Additional diagnostic tools: blood glucose level, pulse oximetry, ECG, 12-lead ECG, pre-hospital Cincinnati stroke scale, and in the future, cardiac enzymes with predictive instruments and abdominal ultrasounds. Neurologic system exam. Level of consciousness. Pulse, motor, and sensory are the basics. Cranial nerves. Pupillary response to light. Ocular movement. Clenched teeth. Show teeth, raise eyebrows. Open mouth and stick out tongue. Gag reflex, and shrug your shoulders. Develop a plan. Gather your likely diagnosis, appropriate therapies. What if? Plan for the worst. Stay 2 steps ahead. Consult an online MD if needed, and transport appropriately. Critical thinking process considerations. Decision-making requirements. fundamental knowledge of the subject. Focus on and organize a large amount of data. Identify ambiguities. Determine relevancy. Analyze and compare to similar situations. Explain decisions and construct logical arguments. Scan the situation. Remain calm and gain control. Focus on the task. Remove any distraction. Systematically gather information and evaluate. Consider options, risk versus benefit. Decide and act. Act immediately as necessary. Communicate your actions. Listen to others and think ahead. Reevaluate during and after. Clinical decision-making process. Form a concept, gathering your information. Interpret the data, your differential diagnosis. Apply known principles, your treatment plan. Evaluate, reevaluate constantly, and reflect. Always remember the 6 R's in critical thinking. Read the scene, read the patient, react appropriately, reevaluate, revise, and review.